Okay, so this is tar B. We'll start off here with our quote. I think this is an interesting quote because it kind of brings to mind the fact that we let time pass us very quickly and we don't realize how much time we're spending with a particular activity or a particular thing until it's already gone. Sometimes that can be a good thing, but other times we let stuff pass us by in our life and we don't realize what we're missing because we don't take the time to slow down, especially in this busy, hectic world we live in now. All right, so first up on our agenda is OSHA. That stands for the Occupational Safety and Health Administration. It's a federal agency that makes rules to protect workers. Next, we're going to talk about standard precautions. These precautions treat blood and body fluids, non-intact skin, and mucous membranes as if they were infected. You use these on everyone, whether they are known to be infected or not. The body fluids included in this include saliva, sputum, which is another word for mucus that's coughed up, urine, feces, semen, vaginal secretions, pus, wound drainage, vomit. It does not include sweat, however, when we're talking about standard precautions with body fluids. Standard precautions, you would wash your hands, you would wear gloves, remove your gloves, wash your skin, wear your mask and your goggles. Anytime that there might be a splash, you will dispose of waste appropriately and handle sharps with care. Standard precautions also make it important to protect yourself. You do not know what other people have, sometimes even after reviewing a chart. This poses an increased risk to healthcare workers if standard precautions are not followed, and employers should have an exposure plan in place for accidents. Safety and body mechanics. You would identify the person's greatest risk for accidents and describe prevention guidelines. This is going to be found on pages 79 through 91 of your textbook. And don't forget, you are also at risk for injury. So not only do you have to be careful about how you turn a patient or lift a patient to prevent injury to them, but you also want to make sure that you're using proper body mechanics so you don't cause yourself an injury while you're lifting. Common injury types for residents, patients, and clients would be falls, burns, and scalds. What about oxygen use with that? What are some things that you'd want to consider when you're using oxygen therapy in a resident's room? Choking, poisoning, cuts, abrasions, restraint damages. All these are things that you need to consider that would be a common injury type. Injury risk to healthcare workers would be not properly using body mechanics. Many long-term care facilities are zero lift. You actually have a lift machine that you use to help you when moving residents around. And more information about this can be found on pages 148 and 149, and also pages 88 through 90. Okay, and there is your reference listed there. Of course, it is our textbook, the third edition of the Hartman's Nursing Assistant Care.